Hello, everyone, and welcome to the SavvyCast. This is Jamie, and I'm so grateful that you're joining, whether you're watching on YouTube or listening to the podcast. Today is going to be a very interesting and important discussion. I have with me Dr. Chelsea Aldred. He is a Birmingham resident. He's actually down the street from where we live. We're neighbors. And I'm going to introduce Justin, and then he's going to tell his story. But Justin is a graduate of Auburn University, and he completed his internship and residency at the University of Mississippi Medical Center in Jackson, Mississippi. And he is currently in an OB-GYN practice, OB-GYN South at Brookwood Medical Center. And he is married to Chelsea Aldred, and he's the father of 3 adorable children, Reese, Hampton, and Caroline. And today we are going to talk with Justin about an experience that almost took his life. And it's something that I think we all need to be aware of. We're going to talk about pulmonary embolism. And Justin, first of all, I want to thank you for taking time out of your very busy schedule to be here.
Absolutely. I'm more than thrilled to tell the story and share with you guys and to your audience what happened to me and some awareness things in the future for everybody.
Awesome. And Justin, just to start out on a icebreaker note, I always ask the first question, what would be your last meal? What would you choose?
That's a good question. Yeah. I'm a foodie. I like a lot of restaurants in Birmingham. Bistro 218, which I'm actually afraid to tell you this on your podcast, but that's kind of our hidden gem in Birmingham. I don't know how many people know about it, but Bistro 218, beef Wellington, when they have it on the menu, is among one of the best meals I've ever eaten in my life. So that would be my last meal for sure.
Okay. Now, Bistro 218, is that near Brookwood Mall?
No. So that's downtown. It's near McWayne Center. I think 19th Street or something like that. But I don't want to tell too many details. If people want to look it up, they can. But
because you don't want to not be able to get reservations because there's a run.
That's right. That's that's our favorite place to go for date nights for my wife and I. And so the beef Wellington there is amazing. It's great.
That's amazing. Well, I will have to try that. That's amazing.
Okay.
Well, Justin, let's just start because you're young, and to have this happen to you, I just want to first of all get you to tell the story, and then I've got a lot of questions, and I know there are some things that that followers are going to want to know as well that might apply to the general population in regard to pulmonary embolism. So just go ahead and tell us your story.
Yeah, so I think it all kind of starts back. I'm a pretty active individual. I love doing exercises. I like endurance type exercises. I do a lot of high intensity interval training type exercises. And it's been 2 years ago now, I had a torn meniscus in my right leg, and I kind of, babysat it, did some physical therapy for about a year. And after that, it ended up not really getting better. And I think I was kind of stubborn, as most physicians are, and not taking good care of themselves when they know that there's a problem. I ended up getting a meniscal surgery this past July. It's very routine outpatient surgery. And it was an arthroscopy, went very well. Went home the same day from an outpatient surgery center, and really felt a whole lot better initially and progressively got better, but the pain was still kind of there. So I ended up going back to a different orthopedist that was a friend of mine and got an injection in my knee joint to kind of help restore some of that cartilage. And that was done in middle to late October. And actually I didn't do any exercises or anything like that for about 4 weeks, and started progressively feeling a whole lot better, doing exercises. And so I was doing my normal thing. And, we're a busy OB-GYN practice, and I got the New Year's call this year. And so I was on call from that Thursday, really through that weekend, through January 2nd. And through that weekend, I just wasn't feeling well. I just felt like I was short of breath. In the midst of COVID, I was like, man, do I have COVID? I don't know what's going on. But I continued to kind of work through things. I didn't really have the COVID symptoms other than just kind of fatigue and just didn't feel great. But I was negative. I actually tested and I was negative. And so I was like, well, okay, it's not that. And I just kind of kept grinding through the weekend and doing my thing. It was a pretty busy weekend, actually. And so the January 2nd, that night, or that afternoon, rather, I was exercising. I was just doing some light stuff, and I could not finish more than 10 minutes of a workout. And I said, man, I just need to take it easy. And so I went inside and really laid low the rest of the day. And kind of something that's important for just my thought process was back in October, before I got that injection, I had a repeat MRI of my leg, of my knee that was hurting me. And they said I had something called a Baker's cyst. So a Baker's cyst is kind of like an expansion of a cyst that can kind of come right behind your knee joint in the same area where most deep vein thromboses can actually originate, and where most of them are found. And that's where a lot of symptoms from DVTs, which ultimately can go to your lung and cause a pulmonary embolism, can originate. And so,
okay, let me clarify.
As that weekend, yeah.
Justin,
please.
okay, so let me clarify. The shot to which you're referring was a steroid shot?
No, so a shot that I got in my knee is called a PRP. It's called a platelet-rich plasma. So basically what they do is they take your own blood, they spin it down, they get your plasma cells with some platelets in it to help regenerate some cartilage within your knee joint. And so that was going to help kind of regenerate some worn down cartilage and help improve pain. And so leading up until that injection, I got that MRI done just to make sure that that's what it was. And that indeed was what it was. There was no mention of any type of blood clot at the time, although it was an MRI and not the most useful thing to identify blood clots. Ultrasounds are usually used for that. But that's what prompted the injection. But I also discovered that I had a Baker's cyst at the time, which is, like I said, where that pain can originate. And that can be somewhat uncomfortable to people, but it's something that resolves with time, just with rest and NSAIDs and icing and things like that. And so
a Baker's cyst is not necessarily a precursor to DVT.
No, ma'am. No, ma'am.
Not for everyone. Okay.
Yeah, not for everyone. That's right. And so,
okay.
But in my mind, the weekend leading up until this event, I began to have pretty significant calf pain and kind of right behind my knee pain. It wouldn't bother me during the day, but it would wake me up in the middle of the night for about 2 nights in a row. And the Sunday night before everything happened, I woke up in excruciating pain and kind of tapped my wife next to me and said, hey, I need something like some medicine. Give me some ibuprofen or something. My knee is killing me. So she got up and went and got me some ibuprofen. And eventually it kind of subsided after about an hour and I was able to go back to sleep. I woke up that morning, kind of did my usual routine around 5 a.m., got my coffee, set and kind of meditated in God's word a little bit. And then I went into the hospital. I had to get there around 6 a.m. because I had 2 C-sections I had to do. So I actually went and saw those 2 patients prior to proceeding forward, but I just wasn't feeling well. I think as I walked from my car into the labor and delivery unit, I was progressively just kind of short of breath and just didn't feel myself. And so after I had seen those 2 patients, I left and I walked up the flight of stairs to our office, and one of my older partners was there, and he said, "Man, you don't look well." And I said, "Well, I don't feel well at all." And he says, you need to probably go to the ER." When I was describing to him just shortness of breath and felt some heaviness in my chest, but rather than going straight over to the ER, I wanted to make sure I needed to go. So I walked back down to labor and delivery, and one of the nurses there got us an O2 sat probe, and which calculates your oxygen saturation, and then it also calculates your pulse. And at the time, my O2 sats were about 92%, surprisingly, which is not terrible for what was going on. But my heart rate was 138. And so I knew that something wasn't right. And so I immediately left labor and delivery and went straight to the ER. And it was funny. The thought in my mind on the way to the ER was my insurance card is in my truck. So do I need to go back and get my insurance card in my truck? And my second thought was, if I do that, they're probably going to find me dead in the parking lot.
Oh
And
my.
so yeah, it was kind of that panicky, anxiety provoking sensation of I've got to get help now. And
So it's getting worse. It sounds like now it's connecting mentally that something's
correct.
Really okay.
Something's wrong, because my base heart rate is usually in the 60s to 70s, and to be in 138 just by walking to labor and delivery is very odd. Mm-hmm. And so I walked over to the ER. They checked me in very quickly. They got me into a room. Wonderful nurse came in, and he began assessing me. And immediately my blood pressure was 185 over 115. And my heart rate at that time was 148. And my O2 sat was around 90. And so they did what they needed to do. They drew a bunch of lab work, and then they got me into the CT scanner, which is how you diagnose a pulmonary embolism. And it wasn't but a minute before the tech came into the room and said, "Your lungs are filled with blood clots." And in that moment, I immediately connected everything together, and I was kind of blown away, to be honest with you. They wheeled me straight from there into another room where an ultrasound was performed on my leg, and it showed an extensive blood clot that was extending from really my groin on my right leg, where I had that previous surgery and where I had some of my ortho problems, and it extended all the way down to really where my foot was. And so in the meantime, I've been texting my wife saying, "Hold off, you don't need to come to the hospital. They're assessing me." And then right when I was told that I had pulmonary embolisms, my wonderful wife left the house. My kids were taken care of, and she made her way to the ER. And then after
did you tell her?
I think I really just text her, "This is bad. I think you need to come up to the hospital." I don't know if I told her yet I had a bunch of pulmonary embolisms. Yeah. Didn't want her wrecking on the way to the hospital. She made her way. She got there pretty quickly. And then I made it back to the room. The ER doc came in and basically just told me what was going on. And by the providence of the Lord, one of the interventional cardiologists at the hospital was actually already in the ER. And I don't know if he had a case before mine or what, but he came into the room. They did an echocardiogram, which is an ultrasound of the heart, and they said that I was in heart failure from the massive strain. It's, imagine if you have a river and you put a big log in front of it, you back up all that water behind it. And so that's basically what was happening in the right side of my heart. It was backed up and pulled up, and so that explains the shortness of breath. It explains all the symptoms that I had kind of been experiencing. And so the interventional cardiologist came in the room and said, "Listen, we got to take you to the cath lab, and this is emergent. We're going to take you in there. You'll be awake, and you're going to get these pulmonary embolisms out of your lungs." And so they wheeled me in there, and at that point, I'm a physician at the hospital. You're really naked. I mean, you're rolling in there naked with a towel kind of partly over you as you're fully exposed before all. And as I get in there, you're wide awake, you're seeing everybody, but we had some incredible nurses and people that were keeping me calm during that time.
Were they able to give you medication, or did it? I know with the heart, were they able to give you something to calm you?
Yeah, so before they do one of the things before they said that they didn't want to do is they had to have me pretty alert initially, so that I could follow some of the commands of the cardiologist as they started the cath procedure, so that I could do some breathing exercises to get proper imaging to locate exactly where these clots were. And so initially I was not under any medications, but when he started getting into more of the procedure to removing of the clots, they did give me medications. They gave me some Versed and some things to kind of help me relax. Although I remember every bit of the procedure, and I can recall really every detail of it. And I think it's just you're at such a heightened awareness when things like that are going on. And I don't know how many, they would have to give me quite a bit of stuff to really knock me out. But
So
yeah,
when
so he did. Yeah, go
so
ahead.
when you say you are aware, they're taking out clots, but you're on Versed, but you're feeling that
Yeah.
you're feeling what
Yeah,
sort of
so
what's
it's really interesting. Before I got any medicine, they put a wire catheter through your kind of through your groin area. That's where they access your arteries and your veins. And so, well, for me, they were accessing a vein, and so they passed that guide wire kind of up into your chest, and the feeling is as if you have something kind of stuck in your throat. I'm looking at the screen, I see where the wire is in my chest, and you feel a tickling sensation kind of centrally in your chest. And it kind of, it makes you take some breaths, because it kind of takes your breath away. Imagine like jumping into an ice cold, bath, and it kind of does that to you a little bit.
Mm-hmm.
But then he did that first on the left side, and then he moved over to the right side, which is where the procedure was performed. And when he did that, that's when I received medications, and he began pulling out massive amounts of blood clot from my lungs. I mean, he actually took a picture at the end, and it was, I haven't counted them, but they are some as long as a spaghetti noodle, and some as small as kind of a fingernail. I mean, they are huge. And so he took a picture and sent it to me afterwards. I immediately went to the ICU following the procedure. And when I got there, again, met with some wonderful nurses. I ended up staying the night in the ICU, and then I was actually discharged the following morning, because I things went very well for me. And so to follow up that, shortly after the procedure, I ended up following up with a fabulous hematology oncology physician at Brookwood, who's been doing this since before I was born. And he ran a bunch of labs on me, and I discovered that I had actually a clotting disorder that I've never known about. And I played sports and through high school, and even at the beginning of college, I played a little bit in college, and so I've never had any blood clots, never had any really speakable injuries, certainly never had any surgeries. And so it was, is this inheritable? How did this happen to me? What happened? And so anyway, I got some lab work back, and it took about a week and a half or so to come back. And it was found out that I had something called protein S deficiency. And so protein S deficiency is basically a inherited disorder where you lack a important enzyme in our clotting. That protein S, when present in normal numbers, actually helps prevent our blood from clotting, so that our blood will flow normally, and help us really sustain normal blood flow and keep us living. And mine was at such a low functionality, when these labs came back, it was enough to say that I have protein S deficiency.
Protein S deficiency, and it's
That's correct.
inherited, but there's not a test for that. And throughout your whole life, there was never, ever
No.
anything indicative that there was an issue?
Yeah, no, not for me personally. Now, my father had some blood clots in his history, but they were always related to cancer.
Mm-hmm.
And so cancer, obviously, cancer is one of those things that increases risk substantially for blood clots. And so there was never a workup for, never a need to really work up any type of blood clotting disorder in my family. The type of disorder that this is, it's actually an autosomal dominant trait. And so, which means it's actually quite easy to inherit from your parents if you happen to have it. But there's something called incomplete penetrance. So it's not to get too scientific, but incomplete penetrance is something where you can actually have the trait, or you can have the protein S deficiency, but it doesn't actually present itself fully in generations or in individuals. And so for me, I actually inherited the trait, and not only did I inherit it, but it actually presented in a very full a full function and a full expression. And so, we think that the knee injury 2 years ago, and then the surgery, and then the rehab and things like that was kind of one of those instigators for me, because I tend to clot a lot easier than others. And so it's something that presented in this way. And thank the Lord, I'm still here to tell the story, because a lot of people don't get that opportunity, because when they find out about it, it can be a time when it's lethal, it's deadly. And so I had the right people in the right place at the right time to really help kind of diagnose this.
Well, do you have a follow-up medical protocol that you're on? Like, are you on heparin or aspirin?
Yeah. So I'm on Eliquis, and I am on Eliquis for life. And so Eliquis is a wonderful newer blood thinner as compared to our heparins or our Lovenoxes or our warfarins or Coumadin. And so it's one of those medicines that I really just have to take one pill a day, and I'll take that for the rest of my life. And that should really help prevent future blood clots. And so, yeah, I'm married to that medication for life.
Wow. So, Justin, as far as pulmonary embolisms go, is this a more rare cause of a pulmonary embolism? Is there a more common cause that the general population might be more prone to having them because of that?
Yeah, absolutely. I think I think that protein S deficiency would certainly be one of those rarer causes of pulmonary embolisms. In young people, whenever you have a clot, it's very important, and most physicians would do a workup as to why that clot occurred. There is protein S deficiency. There's also something called, that's a little bit more common, called factor V Leiden deficiency. And that's something where factor V Leiden is important, again, for clotting. And we, in my profession at least, discover this in many women who get initiated on type birth control pills or, something like that. And then they turn around within a month or two and have a blood clot after starting those. That would be an instance where factor V Leiden is probably something pretty common. Another very common cause of blood clots, like I mentioned earlier with my dad, are malignancies, cancers, things that cause us to be hypercoagulable. Big surgeries are things that can certainly lead to blood clots, especially orthopedic surgeries like knee replacements and things like that. Those are things that can cause deep vein thrombosis and eventually pass on to your lungs.
Why would orthopedic be one of the more serious surgeries that would cause that, as opposed to, say, a C-section or another type of surgery?
Well, I think it's just generally where the locations of these surgeries are performed. So if you think about your legs, you're more distal. The more distal you get from the central venous circulation, which is kind of where your heart and things are, the more likely you are to develop deep vein thrombosis. So, your lower legs, that's a gravitational area. And so when you have things like knee replacements, those are big surgeries, and they can be somewhat bloody. I mean, you have to go through vasculature, and as your body tries to heal from that, blood clots can form in those areas. And then over time, they can eventually pass to your lungs. Now, there are good protocols for orthopedic surgeons, and I'm in no stretch of the imagination an orthopedic surgeon, but there are protocols that they typically put patients on prophylactic anticoagulation, after surgery, that helps prevent until they're mobile, until these patients really get up and start moving around. And so it's much rarer these days than it was previously in the past when we were not doing that. And so, but yeah, C-sections, listen, I mean, so C-sections and even vaginal deliveries and those are all risk factors, especially in regards to obesity, or if you have comorbidities like hypertension or diabetes. Those things can help or can actually make blood clots more more possible. But there's things that we do in the hospital that help prevent those blood clots. Little squeezer massagers on the legs and things like that can be placed. And we usually do that when patients aren't mobilizing well.
Well, can you tell us the signs that you will surely have if you have a pulmonary embolism?
Sure.
Everyone will have, say, what, breathlessness, leg pain? What are the just across the board?
I think thinking back, so a very common thing is a cough. Mine was a dry cough. It felt almost like a constant tickle in my throat. And I think that was present really about a week before everything happened. Shortness of breath certainly is something that you can experience with a pulmonary embolism. For me, it felt like a tightness in my chest. It felt like a really, like I couldn't, like the old saying of an elephant feeling like it's sitting directly on my chest. No matter how big of a breath I took, I didn't feel like I was getting enough oxygen. Another common thing is chest pain. You can experience chest pain from these, and even radiation of pain up into your jaw, typically up into your jaw or down your left arm. Those are things that can present itself, especially if you have any type of heart strain from the blood clot in your lungs. And even before it goes to your lungs, things to look out for, which I was contributing to a Baker cyst in my leg, are calf pain. And it feels as if someone has punched you in the calf, but it's not letting up. Or it feels as if you just don't have oxygen going to your muscle. And it's almost like your leg is kind of dying or something. I mean, that really is what it felt like. It was pain that really took my breath away.
How long did that pain go on? Was it weeks leading?
Yeah, no, I truly didn't feel that intensity of pain until probably the 2 nights leading up until I had the pulmonary embolism was really when that happened. And so that's when the pain was most extensive in my right calf, is really the 2 nights. But, it can be in your calf. It can be behind your kneecap. It can even be up in your groin area. So that any unremittent pain in those areas can be signs of a DVT or a deep vein thrombosis.
Okay. And this may be a dumb question, but does DVT always start in one of the legs?
Not necessarily. By far, the most common place is the lower extremities. Yes, it can start in your femoral veins that are in your legs. It can come up to kind of where your inguinal area is, or kind of where your groin area is. Once you get past there, it opens up almost like a river going into an ocean. I mean, it opens up a lot more. So it's very rare to have blood clots in the central venous circulation, just primarily because it's so big. You can have superficial clots in your arms. It's much less common to have blood clots up in your upper extremities because, like I said, it's more of in a gravitational area where your blood's having to pump against gravity. And so that causes that blood to kind of stay still and has more of a propensity to clot in those areas. And so your lower extremities are usually the most common area.
Okay. Even though you are taking the medication, do you wear compression garments when you're flying, or do you take any extra precautions?
I don't know. I don't. Right now I'm active. I'm back to full activity. I actually had a follow-up CT scan, which showed it was a clear scan. I had a clear ultrasound of my right leg as well. So all of the blood clot got reabsorbed, thankfully. That any blood clot that was left. And then I also had a follow-up echocardiogram, which showed complete reversing of my right heart failure. And so I'm, really my goal is to, obviously stay on the Eliquis and then to stay very active as I go forward. So I want to continue to exercise and build up my cardiovascular strength. And so, I think I'm a hunter. I like to hunt in the woods. And so one of the main things is you're obviously sitting for a while when you do that. And so I think from here on out, I will likely wear probably compression stockings kind of in my lower extremities when I'm sitting for longer periods of time. If I go on a long plane flight, I'll get up probably every hour and walk around and things like that. But no day-to-day differences other than just the blood clot or the blood thinners that I'm taking.
Okay. And this is all so helpful. And I want to ask you, because a very close friend whose father is actually in the medical field, but had a similar situation. And I'm not sure, but I know there were several tests run at an outpatient center. Her leg, and this was weeks prior to them finding very extensive clotting, and both were clear. And I'm not sure, I want to say MRI, but can you just tell us which tests, if you feel, ooh, something's not right?
Yeah.
Can we as patients go to a facility and say, we want to go straight to the test that will tell everything? Because feasibly, some people can, wait until it's too late. So could you tell us how to get straight to the gritty?
Yeah. So I think, if you're feeling those symptoms, first you want to talk with your doctor, because every situation will be individualistic and different for different people based on vital signs, which are really a telltale sign, based on symptoms and really, doing a physical exam. So as physicians, we don't want to just jump straight to, imaging, although it feels like sometimes that's what we tend to do. But, an exam is very important. So doing a detailed physical exam on the lower extremities, listening to the heart and lungs with a stethoscope. And then if the physician that's assessing the patient or assessing you as an individual feels that imaging is necessary, then yes, I think certainly there are images. The gold standard for detecting a pulmonary embolism that we utilize in a clinical setting is a CT of the chest, or a CT angiogram, or CTA. And so that's what we order if we have a high index of suspicion that there is a pulmonary embolism. And if you feel as if there is a DVT, then you get a duplex Doppler, which is an ultrasound of the lower extremities. And they do it all the way from your groin, right where your leg attaches to your midsection, all the way down your calf. And it's none of which are painful. These are very easy imaging modalities that we can have, and they're actually very quick to get back. As far as labs go, there are some indicators on lab work that you can get. So something that's really important is a D-dimer. A D-dimer is an indicator that a clot could be present, and also evaluating for any type of heart strain. There's something called a troponin level, and a troponin is what your muscle of your heart releases into the bloodstream when your heart is under distress. And so those are two really important, lab work modalities that we can utilize to kind of help gather the picture. So physical exam, CTA of the chest, and then duplex Doppler of the lower extremities, and then a D-dimer and a troponin level are really good places to start.
Okay. And so what is your best advice to people listening or watching who maybe want to try to prevent this? They don't have any reason to believe they have this. Prevention and just working well with your doctor. Is there anything to do to prevent it? If you've got what you had, there's really no prevention, right? That it was going to come out at some point.
Yeah, I think for me, I look back and I shouldn't have been the doctor of myself. So I think if you ever have symptoms, don't neglect bringing those up to your physician. So I think, my regret is kind of poo-pooing off my symptoms the entire week leading up to the event, not really putting those things together, or just internalizing what I was feeling, not really communicating them with people, and just thinking, okay, I'm figuring this out. And it's kind of in our day and age too, with COVID that's been so rampant. I think a lot of us are fearful to bring up symptoms, to bring up things that have, man, these people aren't going to want to be with me. I'm not going to be able to do half the things that I want to do. I'll have to isolate myself and things. And so I think there's some of that fear. I think annual exams are extremely important. Bringing up symptoms that are concerning, that are not usual for you as an individual to your physician, that's what annual exams are about. We want to know what is going on. We want to know, and I think women have easier access to this because they go to their gynecologists, or they typically have primary care physicians at a younger age than men do, just because of pregnancies or whatever it may be. And so, yeah, I think I would just tell the listener base to just be honest and open with your physician. Don't ever try to self-diagnose yourself. I think there's a place for Googling things, but I also think that can lead you down rabbit trails. And, so I think, trust your medical healthcare provider. And if you're not comfortable with that advice, there's always second opinions. And, I always encourage people, listen, if you want to go get a second opinion, or if you want to get somebody else's input on this, go seek that out. That's important for people. And that's why, you have the autonomy to do that. And there's so many good physicians, especially right here in Birmingham. And so, yeah, I think just being cognizant of symptoms and bringing up things that might not feel right to you, and then allowing the physician to kind of take control and really and lead you down the proper path of how to make a proper diagnosis.
And also know your genetic history,
That's right.
Now, are your children, do they have to be tested now for this?
Yeah. So my kids will at the proper time. Now I have a 9-year-old, a 7-year-old, and those are 2 boys, and my youngest is a girl. She's 4. And so at the proper time, we will certainly get her tested and get them tested as a whole. It's really important for females, primarily because these clotting disorders can really lead to devastating outcomes with pregnancies. It can lead to infertility. It can lead to recurrent miscarriages. It can lead to early losses in the second trimester of pregnancies. It can lead to catastrophic outcomes for patients who happen to make it all the way to delivery, and then they end up with a pulmonary embolism or something like that. So, yes, my kids will be tested at the proper time, and my hematologist will be doing that testing for them. And my brother and his family's done that, and they live in Nashville. My mom's been tested. My dad since passed away, so he can't be tested, but my mom thankfully was negative, so I'm pretty sure I'll receive some of this from my dad's side of the family, or really the entirety of this from my dad's side of the family. But yeah, we'll for sure be getting my kids tested in the future.
Well, if someone just wanted to take the test and pay for it, will a hematologist see just the common person who doesn't necessarily have any risk factors, but who just wants to know, hey, do I have a clotting issue that I'm not aware of?
Yeah. I don't know. I think a family history or a personal history would be needed in order to initiate that. And I say that primarily for insurance coverages and just and really just for protocol. I mean, I don't know if we need to just be testing everybody willy-nilly on blood clotting risk without any personal or family history, because that would be quite expensive, but it would also yield very little. I think for patients who do have a family history or who have a personal history, especially those who are young and without those risk factors, need to be tested if they've ever had a pulmonary embolism or a DVT.
Okay. And before we wrap this up, I want to ask you, as a physician who would naturally prescribe the birth control pill in many cases, do you have a certain birth control pill that you feel might be, I guess I'm looking at the risk of young women. Do you screen them, or is there any consideration with which one you prescribe to which girl?
Sure,
woman?
Yeah.
Woman, I meant.
Yeah. So I think, we always get a family history and a personal history on really everybody that comes in through the doors of the clinic. And so, yeah, I think based off of those family histories and based off of those personal histories, then we can tailor birth controls for different women. If, for instance, you do have a clotting disorder and you are a woman that has a clotting disorder and desires some form of birth control, my recommendation would be either a hormonal or non-hormonal intrauterine device. Those are devices that go within the uterine cavity. And those are great because it's either a non-hormonal option, which is a copper IUD, or you would want to go towards like a progesterone containing IUD, and there's multiple brands, but that would provide localized hormone to the uterus, and that doesn't have systemic absorption to further increase risk of blood clots. Mm-hmm. And so that would be certainly a wonderful option for somebody who has a clotting disorder of any kind, that could provide good birth control, but also bleeding control as well.
Well, Justin, this is absolutely fascinating. And obviously the Lord had a plan for you to be mm-hmm. here, and you are living testimony to that. And I'm just so grateful that you shared this. This is very, very helpful. And I just thank you. And you're welcome back anytime to talk about women's health. I get many questions about women and hormones and things such as that. So I would love for you to come back and talk about that. So, but thank you so much for sharing your story, Justin. And I hope that you will come back.
Thank you so much. I appreciate it. And I want to say, one of the things that I kind of passed over earlier is when I was on the table in the cath lab, people are, moving fast around me, and I'm used to being that person that's moving fast and kind of getting things done. And as I laid there on the table, I've never memorized this verse, but it's from Isaiah 26:3. And it says, "You keep him in perfect peace, whose mind is stayed on you because he trusts in you." And in that moment, the Lord met me in my time of need, my greatest need. And he comforted me with really a peace that surpasses really any understanding. And like I said, I've never memorized that verse, but I promise you, when I was laying there, I felt the presence of the Lord. And even though I was that close from dying, I've never felt more alive. And so it was a profound thing for me. It was a profound event for me, and it's really shaped me for the better, I think, going forward in my life and in my walk with the Lord. So I want to encourage everyone out there. I hope you never have to go through an event that I went through to feel that, but seek the Lord. He protects us. He comforts us in our time of need. And he certainly did for me and my family during that time, and through the people that just supported me following it. So I wanted to share that testimony, and it was an encouragement to me, and I hope it is for everybody listening.
That is very encouraging. And I will follow up with saying that I heard someone say once that you can't experience peace that passes understanding until you're in a situation that you cannot even fathom. It's not something we can just drum up by
conjure up. Yeah.
It takes something almost as dramatic as you've been through, that kind of experience, to truly be able to feel him and his presence and his peace. And wow, what a powerful ending. Thank you for that.
You're welcome. Thank you for having me, and I appreciate you taking the time to talk with me.
Thank you, Justin, and you have a fabulous rest of your day.
You too. Thank you.